Thank you for joining us for CNTV. I'm Brad Clonch along with Quin Tran.
The coronavirus has affected how we live and work. This right here is an example how we're bringing to you this episode. Health officials urge social distancing of 6 feet apart or more to prevent the spread of the virus.
We've been advised to not gather in groups of more than 10 people. Few people have been dining out. People are staying close to home.
Meanwhile, we are learning more about this novel coronavirus.
I am pleased to be joined today in the studio by Dr. John Krueger.
COVID-19, the coronavirus, remains the top story.
While we want the public to be cautious,
Dr. John Krueger is the Undersecretary of Medical Staff and Quality for the Chickasaw Nation's Department of Health. He spent time at KCNP Radio and CNTV to share important information about the coronavirus pandemic.
Why is this virus different? This virus is brand new to humans on the planet. The humans have never seen it and never had a chance to develop immunity to it like we have to other viruses.
It's a virus that is highly contagious with no current vaccine and no cure. That's why drastic measures have been taken: social distancing, self-isolation, business and school closures.
A virus spreads, and when it spreads, it doubles literally every number of days. So whatever you see in infected persons now, you're going to see a doubling rate for a series of days. And so we're going to have a lot more infected people. What we're trying to do by having everybody stay home, wash your hands, distance yourselves from other people as much as we possibly can and isolate ourselves as much as we can reduce the number of people that get spread to and slow down that doubling rate.
Dr. Krueger says these are the symptoms of coronavirus: low-grade fever as low as 100.4 temperature, cough, and shortness of breath or difficulty breathing. Signs and symptoms may appear 2 to 14 days after exposure to the coronavirus.
They hijack our cellular machinery and use that to replicate and make more copies of themselves. And then that's how they eventually spread. Even though this is going to be a trying time, it's going to go on for a while. How long? Don't know. I wish I had a crystal ball to tell everybody, but I don't. But it will probably be a little longer than we all wanted it to be, for sure. And so as all this is going on, one thing I know for sure is that Oklahomans and Americans in general do really, really well in disasters, and we tend to come together when things get bad. So I think this is a great opportunity to do that and have solidarity with one another and just take care of one another during this pandemic.
The pandemic has forced closures across Oklahoma and the country.
All public schools in Oklahoma are closed. With the health of citizens, employees, and visitors in mind, the Chickasaw Nation temporarily closed some venues. Several events and activities have been canceled or postponed. Visit the tribe's website for the latest list of closings and cancellations.
The Chickasaw Nation continues to serve senior citizens with meal programs like this one. Drive-thrus are set up to offer elders meals during the lunch hour. Elders may get the lunches Monday through Friday at all of the 12 Chickasaw Nation senior sites. The tribe is also continuing homebound routes, delivering to those elders. Get location information by calling this number. The Chickasaw Nation is also serving meals to area children. The tribe's Meals for Kids program is a year-round initiative for all youth, ages 1 to 18, offered at no charge. And the program continues during this pandemic.
I think our Meals for Kids program, our MFG program, is really just about meeting the needs that we know are there for our children and our families. We know that hunger lives right here. It lives right here in Ada, Oklahoma. It lives right here within our Chickasaw Nation boundaries. And we just want to be part of the solution and really help to ensure that our children can really just be children and don't have to worry about whether their next meal, where it's going to come from.
Children may receive meals Monday through Friday from 10 in the morning to 5 p.m. Contact the Meals for Kids program for more information.
The Chickasaw Nation's pharmacies are currently operating drive-through and mail-order prescriptions. Lobbies are closed at this time. Patients may pick up their medication through the drive-through lanes or receive any non-controlled medication by mail. Officials say the pharmacies cannot mail controlled medication prescriptions at this time. The Chickasaw Nation has 4 pharmacy locations. These are the locations. All of the pharmacies open at the same time Monday through Friday. They open at 8 o'clock in the morning. Closing times vary from location to location. Again, patients may pick up medication through the drive-through lanes or receive non-controlled medication via mail. Examples of non-controlled medication prescriptions are blood pressure, cholesterol, diabetes, insulin, and antibiotics. If you have questions about your medication or prescription, call your pharmacy location.
Hi, my name's Dr. Wilson. Welcome to the virtual clinic. What can I do to help you today?
Medical officials encourage people to use telehealth if they can during the coronavirus pandemic. The Chickasaw Nation Department of Health's virtual visits are available to patients from 8 a.m. to 10 p.m. 7 days a week. Healthcare professionals evaluate you through the virtual visits based on your symptoms, medical history, and other factors. If you have severe symptoms, such as difficulty breathing, seek care immediately. These are steps to protect yourself from the coronavirus. Wash your hands often with soap and water for at least 20 seconds. If using hand sanitizer, make sure it contains at least 60% alcohol. Don't touch eyes, nose, and mouth with unwashed hands. Cover coughs and sneezes. Throw away tissue after use and wash your hands. Clean and disinfect surfaces often. Avoid large gatherings and close contact with people who are sick. Stay home if you're ill.
The Chickasaw Nation Department of Health initiated the COVID-19 call center to help answer your questions about the coronavirus. This is the number to the call center. It's available Monday through Friday, 8 a.m. to 5 p.m. Utilize the call center or the virtual visits before going to a clinic or hospital. But if you are an older patient or person with severe medical conditions or weakened immune systems, contact your healthcare provider as soon as possible. We'll continue to update you with information to keep you and your family well.
We'll see you back here soon.